Hello, my name is Cary Love, and my special population is homeless women living in the United States. As stated in If the World Were 100 People video, 23 out of 100 people do not have shelter. Each year in the United States, approximately 3.5 million people experience homelessness. Furthermore, the United States has the highest number of homeless women when compared to industrialized nations. And as noted in our textbook, homeless women face unique challenges such as economic and housing needs, family violence, job discrimination, and more. I'm currently employed at a domestic violence and sexual assault shelter and work directly with clients facing homelessness. Today I will look at homelessness among women through both an ecological and individual lens and examine the convergence of predisposing, enabling, and need factors. Finally, I will address the overall risk of homeless women and ways to work towards prevention. Predisposing factors that may put people at risk of homelessness may include their age, location, and gender. According to a 2004 study by the U.S. Conference of Mayors, the homeless population is comprised of 41% single men, 40% families with children, 14% single women, and 5% unaccompanied youth. African Americans make up the majority of the homeless population with 49%, followed by 35% white, 13% Hispanic, 2% Native American, and 1% Asian. HUD's 2015 point-in-time count found that the majority of homeless people were 25 and older, and that more than one-half of the homeless population in the U.S. was in 5 states: California, New York, Florida, Texas, and Massachusetts. Although rates of homelessness are still alarming, homelessness is decreasing, with a decline of 2% from 2014 to 2015 and 11% between 2007 and 2014. There are several enabling characteristics that affect women's vulnerability of becoming homeless, including domestic violence. According to the 2011 National Intimate Partner and Sexual Violence Survey, 1 in 3 women have been victims of some form of physical abuse by an intimate partner within their lifetime. Abusers may isolate victims from their support systems, not allow them to work and control the finances, making leaving an abusive relationship extremely challenging. Many women who want to leave abusive relationships may not have another option for housing or access to shelter. In fact, a 2011 survey found that 18% of families reported domestic violence as the main cause of homelessness. And a Massachusetts study found that 92% of homeless women reported experiencing severe physical and/or sexual assault at some point in their lifetime, with 1/3 of homeless women reporting as current or recent victims of domestic violence. Additionally, women have a higher chance of living in poverty than men, and there are no recorded years in which the amount of women living in poverty hasn't outnumbered men. Compounding the issue is the continued wage inequality. In 2015, full-time working women made only 79 cents for every dollar earned by men, leaving a gender wage gap of 21%. Housing costs are also an enabling characteristic for homelessness, as lack of affordable housing led the list of causes of homelessness in 2004 U.S. Conference for Mayors. This survey found that applicants for assisted housing had to wait an average of 20 months for public housing, 30 for Section 8, and 35 for Section 8 vouchers. Furthermore, 59% of the survey cities stopped accepting applications for at least one housing program due to the length of the wait list. There are also several need characteristics such as substance abuse, mental health, and victimization that affect the vulnerability of homeless women. Substance abuse is both a cause and result of homelessness. For example, substance abuse can cause a person to lose their support network or employment and ultimately their housing. However, substance abuse may also occur after someone becomes homeless, as many homeless individuals begin using drugs and alcohol as a coping mechanism, despite the fact that substance abuse often leads to other consequences, such as an inability to find employment. Approximately 23% of homeless people in the 23 cities surveyed for the 2004 U.S. Conference of Mayors are considered mentally ill, and 30% are substance abusers. Recovering from addiction may be particularly difficult for homeless people, especially when considering the many other needs of people facing homelessness, such as finding food and shelter. Substance abuse and mental illness often co-occur. 21 cities cited mental illness or the lack of needed services as a primary cause of homelessness in the 2004 U.S. Conference for Mayors. Homeless people with untreated mental illnesses may use drugs as self-medication, and unfortunately, people with substance abuse disorders and mental illnesses face barriers finding programs to help them. At the shelter that I work at, we do not have the necessary services for people with extreme mental illnesses, but struggle to find available services in the community to refer clients to, especially when they are also facing domestic violence. Other barriers to substance abuse treatment include a lack of health insurance, waiting lists, lack of transportation, and lack of documentation. Supported housing programs are limited but needed in order to properly address the co-occurring issues of homelessness, substance abuse, and mental illness. The effects on the overall health of homeless women are substantial. Homeless women face a lack of access to health care, with 73% of homeless individuals reporting at least one unmet health need, and 57% of homeless individuals going without a regular source of health care. Additionally, women may face other barriers such as lack of transportation to receive health care, lack of knowledge about resources, and not being able to afford medications or services. Homeless women may also not seek health care due to other higher needs, such as finding food or shelter, or fear of being stigmatized, fear of losing their children, or prior negative experiences with healthcare providers, such as feeling disrespected or ignored. Homelessness also leads to other adverse effects, which are exacerbated from an overall lack of health care. For instance, homeless women are at risk for chronic illness and unintended pregnancies. The ACA has some benefits for the homeless population, although the homeless are not specifically mentioned in the law. For instance, those at or below 138% of the federal poverty level qualify for Medicaid in states that have chosen to extend their programs. Under Medicaid, homeless people have access to behavioral health services, case management, personal care and personal assistance services, and more. However, people experiencing homelessness may have difficulty obtaining Medicaid due to being displaced or because of other barriers such as mental illness. The homeless may need third-party assistance in obtaining and maintaining Medicaid to ensure access. Homeless mothers in particular may need assistance navigating the insurance process to ensure insurance coverage for the whole family, along with other benefits such as TANF and WIC. At my own organization, we do not receive prevention funds. However, we are able to use the Housing First model, in which rather than emergency shelter, we use rapid rehousing to help women facing violence get their own stable and safe housing, and then provide supportive services to keep them there. Other recognized methods to end homelessness include increasing access to federal housing assistance and providing permanent supportive housing for people with mental illnesses, HIV/AIDS, and other health problems. The Coalition for the Homeless also notes certain prevention strategies such as eviction prevention programs, legal services, and new policies and programs such as effective discharge planning. For women specifically, more efforts are needed to close the wage gap as well as other gender inequalities and to work towards ending violence against women. If women aren't able to thrive with equal access to education and employment, then we will continue to see high rates of poverty and homelessness among women and families in the United States. My 3 questions are: what is the primary reason homeless people lack access to health care? Why do you think homeless people face a higher risk of substance abuse or mental illness? What other populations not noted do you think are at high risk of homelessness?